Ranking member for 5 minutes.
Thank you, Mr. Chairman. The Children's Hospital Graduate Medical Education Program is the most important federal investment we make as a nation in strengthening the pediatric workforce and expanding access to care for children. For nearly 25 years, the CHGME program has trained half of general pediatricians and a majority of pediatric specialists in our country. In California, the program funds are used by 7 children's hospitals to train over 906 full-time pediatric residents annually. The program trains doctors who go on to care for children across the nation, including those living in under-resourced and hard-to-reach communities. Many members represent such communities on this committee. The program is absolutely essential to maintaining the pediatric workforce in our country. So it's very, very difficult for me to comprehend why any colleagues are subjecting such an important program to a manufactured culture war that inserts politics between parents, children, and their pediatricians. Specifically, the bill prohibits 19 specific procedures and any type of hormone therapy that could be perceived as gender-affirming for trans youth. I just can't comprehend why these children are being pursued and singled out. There's in my view, there is a real cruelty to this. And I don't use that word very often, but that's the lens through which I see this. The bill threatens precious lives. As one pediatric endocrinologist said, every time politics and medicine commingle, people die. We're already seeing higher rates of maternal and infant death because of abortion restrictions that paralyze providers in an emergency. Now, some Republicans are attempting to ban 19 more procedures and treatments that should be a private decision between patients, their families, and their doctors. Now, well, what's the next area of medicine that we're going to get into and say, I don't know, maybe women beyond the age of 62 shouldn't have any cosmetic surgery? You know, what are they going to do? Drag their husbands in to ask them whether they think that it's a good idea or not? We're treading in territory where we don't belong. These decisions belong in a family, not at the Energy and Commerce Committee, where I don't know how many here can go through and explain all the surgery, what it means, what the doctors are saying, what families say yes, what families say no. We don't know any of that. We don't know any of that. This doesn't belong here. This does not belong here. And it's jeopardizing one of the really gold standard programs that we have in our country to train doctors. And children's hospitals are now being subjected in this culture war with bomb threats. Children's hospitals in our country. I have one of them, a prestigious one in Palo Alto, California, the Lucille Packard Children's Hospital. This proposal also worsens mental health crisis. And we know that regardless of what the age is, the background, the geography, we have a mental health crisis going on in our country. And the committee is trying to deal with all of that. We have in the young age groups rising numbers of attempted suicides. It's really a sad state of affairs. I think this is a harmful, disastrous bill. I don't think it should have ever been brought up. Certainly, the gentleman has the has the right to do so, but I don't believe that this bill belongs here. We should get back to working on the real issues rather than these inventions that are taking place, and pass this legislation to reauthorize this graduate school program that has served our country so well. And I yield back. Thank you.
Generally yields back.